Lung cancer is a major problem in this country, and especially in Alabama. We have a lot of people who smoke in Alabama, and so people can have symptoms which can lead to lung cancer. What are the symptoms? Some of the symptoms is severe shortness of breath, all of a sudden new onset shortness of breath, a lot of secretions that are extra secretion than the usual smoker, and sometimes people start coughing up blood, which is obviously very dangerous. You know that something is going on and you need to go to a doctor. And they can go to the primary care doctor, get an X-ray or a CT scan, and then they'll be referred to a pulmonologist and then to us. We are obviously thoracic surgeons, meaning we do surgery of anything in the chest cavity, the thoracic cavity, the thorax.
Linda Cook was diagnosed with a lemon-sized cancerous tumor in her chest. During surgery, Dr. Sultan learned the tumor was much worse than they had originally thought.
When he got in there, it turned out to be a little worse than he had thought. The tumor had grown around the back of my heart, went up the blood veins, and it took 4 or 5 hours. He had to be real careful, he said, with a laser just going up and down around all those veins.
Using the Da Vinci robot enables Dr. Sultan to make precise maneuvers, ones he couldn't do using conventional surgical methods.
The robot obviously is amazing, amazing equipment, because the arms, robotic arms, can move 360 degrees, which my arm can make only 180 degrees to put stitches in. So doing the surgery and even going around blood vessels, big blood vessel that comes out of the heart, you can go very nicely in using this robotic arm. And then there's precision. You do everything to the T, you know. So you see those things properly. And visualization, you have to only see those operations to see how beautiful it is. You know, you can see all the vessels nicely. It's magnified 10 times more. It's steadier. There's no shaking of the robotic arms. Not that we shake, but but no shaking of the robotic arm, and perfect surgery.
Since I've been home, I've been doing real good. I've never lost my appetite, eating great, and just been doing real good at home.
And the recovery time is amazing, because usually they go home in 2 or 3 days, compared to traditional old thoracotomy with large incisions, where patients stayed for 5 to 7 days. And there's always a chance of more air leaks in bigger operation. So they recover faster, they go back to work faster, they get out of the hospital faster. So basically it's cheaper for the hospitals, it's better for the patients, and there's no loss of work for the patients. They can go earlier go back to work.